had my laparoscopic hysterectomy with a oophorectomy on the 12th of November, just before lunch. I was on an all-female ward. It was a specific gynecological hospital ward. I didn't find it as hard as I thought I might, just because the staff were really kind and supportive, welcoming. As soon as I got there, they expected me. They took me straight to my room, which was at the end of the ward, and it had a door and my own bathroom, so I was fairly separated from everyone else, and I didn't feel like I was being treated as a woman. Doctors kept coming into the room asking what surgery I was having, asking what my name was, my address, my date of birth, just so they made sure that all their details were correct. I had to sign a consent form, just basically allowing them to do the surgery. All the doctors that I met in the morning were really nice and supportive, and nobody misgendered me or questioned my name or seemed confused that there was a man having a hysterectomy. One doctor I saw did ask what name I preferred to be called by, which, although my legal name is Leo, I thought that was really great because it might not have been. I had to put on some surgical stockings in the morning, which are always very tight and difficult to get on, but it was fine, and I walked to the operation ward with a doctor. I did ask whether or not the operation ward was specific to any kind of surgeries, and the nurse said that it was where all the surgeries are done in the hospital, so I didn't feel singled out or like other people knew what was going on, which was nice. I got on the bed by the surgery room, and a doctor said that she'd let me sort my boxes out and stuff in privacy, so that I didn't feel too exposed, which I really appreciated. I think going into surgery is always quite nerve-wracking, especially when you don't know anyone and you're only wearing a robe, and you know that these people are going to be seeing your body and cutting you open, and it's just a very vulnerable position to be in. But they made it quite easy, and they were being really friendly and telling me to think of nice things and asking if I was okay. They gave me an anti-anxiety medication, and they said it would feel like I've had 10 vodkas, which I don't know if they give it to everyone, and I didn't really feel like I needed it, but maybe I did, and it's just routine for them. I don't drink often, if at all, so it just made me feel quite dizzy, and I struggled to keep my eyes open, but they wanted me to keep them open, and then shortly after that I fell asleep. They did tell me I was going to fall asleep with the next medication that they put in through my hand. The next thing I remember was waking up in a ward with a few other people. I couldn't figure out if it was all female or not, but it didn't really bother me at that point. I had quite a bit of bloatedness around my lower abdomen, but that was to be expected, and I was kind of in and out of consciousness from then until about 4 hours afterwards, where I was just kind of groaning and saying I was in pain. They did keep asking what my pain level was, and I think I went from a 6 out of 10 to like a 1 to 2 out of 10 within a few hours, so it wasn't too bad. They also kept checking my blood pressure and my pulse and my temperature, and at one point I felt so like doped up on medication that although a nurse said that she was going to be putting a thermometer in my ear to check my temperature, when she did it I flinched and laughed because I thought there was a bee in my ear. After 4 hours they wanted me to try and pass urine just to make sure I was okay to go home, and I tried, but I sat there for a while and I was only passing blood. not too much blood, but it was significant enough to know that it was definitely blood. So while I was on the toilet, I rang the emergency nurse thing that they have, and the nurse was really kind, helped me up. While I was walking back to my bed, I felt really dizzy and like I was going to faint. So I was put back on my hospital bed and kind of turned at a downwards angle, so I was kind of upside down. I guess that was to kind of get the blood to go back to my head. Because I wasn't able to pass urine, the nurse asked if she could put a catheter in to empty my bladder, because I know I needed to pee, but I just couldn't. I felt like my muscles were too weak and I couldn't really get anything out. So she asked Paul to leave, and she kept talking to me. I was okay with it happening. I knew it was going to be a really vulnerable thing. She put a tube up my urethra, which wasn't that uncomfortable. It wasn't pleasant, but it wasn't painful either. But she kept asking if I was okay, and then all I could hear was water trickling into a bedpan, which was quite surreal. I didn't feel like I was going to the loo, but it was a really long wee, and she was laughing about the fact that it was not stopping, so clearly that needed to happen. Because I was feeling so unwell at that point, they said I could stay overnight, and I was really glad that I could, because I feel like that would have just been really horrible to go home and I just feel like I wouldn't have been able to cope, and I needed that extra support. After another 4 hours, I started to wake up a bit more, and it was around 10, maybe a bit later, that I was happy to eat more and watch some videos and kind of talk more coherently. Although we had 3 nurses suggest that Paul stayed with me just for convenience, we had a nurse that was a bit off with us, and she just made us feel a bit uncomfortable. She also asked if I wanted knickers to change into, because I wasn't wearing anything at that point. And I get it, the ward is so used to working with just women, and it's probably not very common that they have to adjust their language to men or be sensitive about the language they use in case they trigger dysphoria or whatever. That didn't bother me at all, but I can imagine that it might bother some other people. Another nurse came in and asked if I wanted a nightie to sleep in, but then she laughed at herself and corrected herself, said if I wanted pyjamas, and that was kind of more funny than awkward. It was just really comforting being able to hold someone's hand, because that's kind of what I need after surgery. But yeah, the next morning we just waited for a doctor to come in, and my blood pressure and all the notes and documents to be sorted out, and I think we left before lunch, but I can't fully remember. I bled for the first day, and when I went to the toilet and tried to pee for the first time, and there was little splotches of blood on my pyjamas and bed sheets and stuff, but it wasn't fresh blood. It was kind of just really pale, diluted splatters everywhere, which sounds kind of gross, but it was what it was. So this week I've kind of just been in bed a lot on the sofa, recovering. I did ask the nurse what I needed to do about my plasters and whether or not I needed to change the dressings or whatever, but she seemed fairly casual about it. She said she had the same surgery 3 years ago, and she said just to have a bath and take them off with the water, but because I was impatient, I took them off in bed and then just had a shower quickly afterwards. And that was after the 3rd day. I took the plasters off, and there was a lot of sticky stuff, and one of the scabs was stuck to the plasters, so when I tried to take that off, I kind of panicked and put it back. They're really tiny scars. The one in my belly button you can't even see. There's one just above my pubic bone, which is actually the flattest one. I thought it would be the most irritated one because of my waistband on my trousers and my underwear, but I think the pressure of the fabric being so close to my body has kind of flattened the scar a bit and made it heal a lot better than the others. On the 4th day, I tried going up the stairs for the first time, and that was a lot easier than I thought. I didn't feel any heaviness or any pain, which is what they say to look out for, and I had to take it slow, obviously, but I got there. On day 5, I took my surgical stockings off, which wasn't planned, but I was finding them quite tight and irritable, so I thought because I was walking around a bit more it would be okay to take them off, and I haven't had any issues since, but I feel like in the future I probably would have not put them through the wash and just left them on. I also sneezed on the 5th day, which made me a bit worried about, ripping anything or just irritating my scars or anything like that, but nothing happened and I was fine. I've sneezed quite a few times since and nothing else has happened, so that's good. I was also really struggling emotionally, and I still am a bit. I think having surgery just takes a massive toll on your body and your emotions, and especially such an invasive surgery where there isn't much support and you're at home recovering on your own. And I might have some people come around, but I don't have that many close friends that live nearby, so it can be really isolating. And when Paul's at work and I'm at home all day, it's kind of just frustrating that I can't do anything, and I want to be able to clean and cook my own stuff and boil the kettle, but I just feel like I can't really do that yet. I just need to remind myself to be patient and that everything will be fine in time. I always have a bit of a breakdown a few days after surgery and just cry, and I think that's just part of me, and that's just something that I need to get used to and accept, because it's not really dependent on my situation. It kind of always happens at the same time, and I remember just trying to hold it in to a certain extent and then just not being able to anymore and just sobbing. I also stopped taking my painkillers after the 5th day, mostly because I didn't feel like I was in pain, and the only pain I had was superficial, along my scars if I touched them, and some occasional cramping, which kind of feels similar to menstruation cramps. On day 6 I started getting a more tender stomach, kind of feeling more bloated and not really bruised, but sort of similar vibes to bruising, if that makes sense. My stomach issues on day 6 kind of reminded me of the first few days of menstruating, which was difficult but also okay. I didn't feel too dysphoric about it. It kind of just felt like the first few days where you're not sure whether or not you've got a upset stomach or if it's menstruation. It wasn't that bad, it just felt like a mixture of bowel issues and cramping, and it was just a bit messy. I think it's been 2 days since I've last taken pain medication, and I'm a week and 1 day post-op. So the pain hasn't been too bad at all. Not barely as bad as I thought it was going to be, which is good. I kind of decided that I wasn't going to go back to work or university until the danger zone of bleeding is over, because the nurses said that you'll bleed for a few days and then stop, and then possibly at 2 weeks you'll start bleeding again. But they said that the bleeding after 2 weeks is because the internal stitches just by your cervix are dissolving, which causes you to bleed. And I think it would be too distressing to go back to university when I'm conscious about bleeding because of that reason again. I'm having a hard time accepting that, because I feel like I should get back as soon as I feel able to look at any academic reading or anything like that. But I also have to remember that I've just had major surgery, and this is going to alter my life, and uni can wait. I'm just taking time for myself. That's about it for the first week. I hope everyone's doing well, and I hope you're having a great day and a great week and a great month and a great everything. Thank you so much for all the support on Instagram and Tumblr and Facebook and on YouTube. If you've done that, thank you so much, and I really do appreciate it. Hope you're doing well, and I will speak to you soon. Bye.